Impetigo is a highly contagious bacterial skin infection that primarily affects infants and young children, although adults can also contract it. It is characterized by red sores, blisters, or honey-colored crusted lesions on the skin, especially around the nose, mouth, hands, and feet. Impetigo is not typically serious but can be uncomfortable and unsightly. Prompt treatment is important to prevent complications and reduce the risk of spreading. Causes of impetigo. Impetigo is caused by two types of bacteria: Staphylococcus aureus, Streptococcus pyogenes. These bacteria can enter the skin through small cuts, insect bites, or other minor injuries. In some cases, impetigo develops on otherwise healthy skin. Conditions like eczema or other dermatological disorders can increase the risk, as they compromise the skin's protective barrier. Poor hygiene, hot and humid climates, and close contact with infected individuals, example in schools or daycare centers, can also facilitate the spread of the disease. Types of impetigo. There are two main types of impetigo: non-bullous impetigo, crusted impetigo. This is the most common form. It begins as red sores around the nose and mouth. The sores rupture, ooze, and form a thick, golden yellow crust. Itching and mild discomfort are common. It may spread to other areas of the body through scratching or touch. Bullous impetigo. More common in infants and young children. Caused mainly by Staphylococcus aureus, which releases a toxin that causes the skin to separate and form large, fluid-filled blisters, bullae. These blisters are usually painless but may be itchy. When they rupture, they leave a red, raw-looking area that may crust over. Commonly appears on the trunk, buttocks, and limbs. Symptoms: red sores or blisters on the skin. Honey-colored crusts forming after the blisters break. Itchy rash. Swollen lymph nodes, occasionally. Mild fever, rare. Spreading of lesions to other parts of the body or to other individuals. In some severe cases, if left untreated, the infection can penetrate deeper layers of the skin and lead to complications. Transmission. Impetigo is extremely contagious. It spreads through direct contact with an infected person, touching contaminated towels, clothing, or bedding, scratching or touching infected sores and then touching another body part. Because of this, children in close contact environments like daycare centers, schools, or playgrounds are particularly vulnerable. Diagnosis. A clinical diagnosis of impetigo is usually based on the appearance of the skin. In some cases, especially if the infection doesn't respond to initial treatment, a healthcare provider might take a sample from the affected area to identify the bacteria and determine the most effective antibiotic. Treatment. Treatment is typically straightforward. Topical antibiotics, example mupirocin or fusidic acid. These are applied directly to the affected areas for mild cases. Oral antibiotics, used for more widespread infections or if topical treatments are ineffective. Hygiene care, keeping the infected area clean and covered, avoiding scratching, and washing hands regularly can speed up recovery and prevent spread. Soaking or washing the crusts with warm water and mild soap before applying topical medication can help the skin absorb the antibiotic better. It's essential to complete the entire course of antibiotics, even if the symptoms improve early. Prevention. Maintain good personal hygiene. Clean minor wounds and insect bites immediately. Avoid sharing personal items such as towels, razors, and clothes. Keep infected individuals at home until they're no longer contagious, typically 24 to 48 hours after starting antibiotics. Disinfect surfaces and wash contaminated clothing regularly. Complications. While impetigo is usually not dangerous, potential complications include cellulitis, a deeper skin infection that may require more intensive treatment. Post-streptococcal glomerulonephritis, a rare kidney condition that can develop after impetigo caused by Streptococcus bacteria. Scarring, usually minimal but may occur if the lesions are severe or scratched excessively. Recurrent infections, especially in environments where hygiene is compromised. Conclusion. Impetigo is a common and highly contagious skin infection, particularly affecting children. Though it is usually mild, timely diagnosis and treatment are crucial to managing the condition effectively and preventing further spread. With proper hygiene, early intervention, and responsible antibiotic use, most cases of impetigo resolve quickly without lasting effects. Public health education and awareness are vital in controlling outbreaks, especially in community settings like schools and daycare centers.